So we want to start today on teams in healthcare system. Teams in healthcare systems. Team in healthcare systems. An effective teamwork is globally recognized as an essential tool for constructing a more effective and patient-centered healthcare delivery system. And so, when we are talking about team, we have different types of teams. Different types of team. We have the core team, C-O-R-E, core team. We have the coordinating team. We have the contingency team. We have the auxiliary team. And we have the support services and administrative team. So quickly, I want to give us the definition or the meaning of these teams. In all, we have about 5 teams altogether. Core teams, these are directly involved in caring for the patients. Core teams are directly involved in caring for the patients. For example, we have our nurses, our dentists, our pharmacists, our doctors, and so on like that. These are core teams in a hospital. Then we have coordinating teams. These are the group responsible for operational management. Coordinating team are the teams responsible for operational management in the healthcare setting. Then we have the contingency team. The contingency team, these ones are formed in order to deal with emergencies or special events. Contingency teams, these are formed to deal with emergencies or special events. Then the auxiliary team, this group supports services that facilitate patient care. Auxiliary team supports services that facilitate patient care. For example, we have the cleaners. We call them domestic workers or domestic staff. These are the group that are giving supportive services in order to facilitate the care given to patients. Then the last type of team is the support services and administration. Support services and administration, those who provide indirect tasks. These are people that provide indirect tasks. For example, we have the secretaries and the executives. Let's quickly go to stages in a team. We have just talked about the different types of teams that we have. Core teams, coordinating teams, contingency team, auxiliary team, and the support services and administration. Now I want to look at the stages in a team. We have about 5 stages, or rather 4 stages in a team. We have the forming stage, we have the storming stage, we have the numbing stage, and we have the performing stage. 4 stages. The forming stage typically characterized by ambiguity and confusion. At this stage, we begin to see confusion. People are still very new in a stage like this. So people are still getting confused about what the team is all about. That is the forming stage, F-O-R-M-I-N-G. Then the next one is the storming stage. The storming stage in a team is a very difficult stage when there may be conflicts between team members and some rebellion against the assigned task. You see, there will be conflicts at this stage. People want to know why they are even there in the first instance. Arguments, disagreements all over will begin to happen at this storming period. Then from storming, we now get to numbing stage. At this stage, there will be open communication between members, open communication between or within members, and the team starts to confront the task at hand. They want to begin to look at the task ahead of them at this very stage. Then the last stage in a team is the performing stage. At this stage, the team focuses all its attention on achieving the goals. Forming stage, there will be confusion. Storming stage is a very difficult stage when there will be conflicts within groups. Norming stage, we have open communications between members, and at performing stage, the team focuses its attention on achieving the goal. Okay, so we want to look at another topic entirely right now. You see, we want to look at a case study, and we have with us breast cancer. Breast cancer, that is cancer in the breast. Cancer in the breast. How do we detect it, and how do we treat it? Breast cancer may or may not cause any symptoms. Some women may discover the problem themselves, while others may have the abnormality first detected on a screening examination. Some may not get any symptoms at all, while some may just discover the problem themselves, while others may have the abnormality first detected during screening. What are the common breast cancer symptoms? What are the common signs and symptoms of breast cancer? I want us to be very fast here because we have very short time today. Common breast cancer, the symptoms. Number one, we have non-painful lumps or masses. Non-painful lumps or masses. Number two, swelling under the arms. Swelling under the arms. We have skin changes, nipple skin changes. There will be changes in the nipple. Okay? Then there will be noticeable flattening or indentation of the breast. Flattening or indentation of the breast. Then we have change in the nipple. There will be change in the nipple. Then we have unusual discharge from the nipple. There will be some discharges from the nipple. Unusual discharge from the nipple. Then we have changes in the feel, size, or shape of the breast tissue. When you begin to touch the breast, you begin to feel a change in the size and shape, even in the way you feel it. Okay? So those are the signs and symptoms of breast cancer. I repeat, lumps or masses on the breast, non-painful ones. Then we have swelling under the arms. Then we have changes in the nipple skin. Then we have flattening or indentation of the breast. Again, we have changes in the nipple. Then we have unusual discharge from the nipple. Then changes in the way you feel concerning the size or shape of the breast tissue. Now, we want to look at types of breast cancer. Types of breast cancer. Types of breast cancer. Number one, we have the inflammatory one. Inflammatory cancer. Inflammatory cancer. Inflammatory cancer. You see, this one is very rare. Does not have a breast lump. Okay, it does not have a breast lump or masses. These are inflammatory cancer. This one doesn't have any mass on the breast. Then we have one that we call invasive ductal carcinoma. Invasive ductal carcinoma. Invasive, INVASIVE, ductal, DUCTAL, carcinoma, CARCINOMA, invasive ductal carcinoma. This is the most common type of breast cancer. About 80% of all breast cancers are invasive ductal carcinoma. Okay? Then the third one is ductal carcinoma in situ, that is in place. Ductal carcinoma in situ, SITU, is considered to be a non-invasive. This one is non-invasive, you see. And it means that the cancer starts inside the milk ducts. It starts inside the milk ducts, DUCTS. Okay, so carcinoma refers to any cancer that starts in the skin or other tissue, including breast tissue, and in situ means in its original place. Then the next type of cancer is invasive lobular carcinoma. Invasive lobular carcinoma, INVASIVE, lobuma, LOBULAR, then carcinoma, invasive lobular carcinoma. This is the second most common type. Lobular means that the cancer starts in the milk producing lobules. Lobular means that the cancer starts in the milk producing lobules. Okay? Mucinous, MUCINOUS, carcinoma. Mucinous carcinoma is a rare form of invasive ductal carcinoma. It's a rare form of invasive ductal carcinoma. Okay, then we have triple negative cancer. Then we have Paget's disease of the nipple. Paget's disease of the nipple, PAGETX, disease of the nipple. So those are the few number of breast cancer that we have. We have almost 1, 2, 3, 4, 5, 6, 7, 8 or so. So you just have to know all these types of breast cancer, and you must be able to know the most common one and the second most common one amongst these types of cancer. Then what are the causes of breast cancer? What are the causes of breast cancer? Number one, we have the biological or internal factors. Biological or internal factors. For example, age, gender, age, gender, Then the next cause of breast cancer is environmental. The environment can be a cause. Then we have exposures. Then we have occupational risk factors. Occupational risk factors. We have lifestyle-related factors. Then we have medical treatments with chemotherapy. Chemotherapy stands for drug therapy. Okay? Then we have inherited genes. Inherited genes. You see? Then we have detection, like X-ray. See, X-ray, breast ultrasound. See, biopsies. See, we have breast cancer prevention. Okay. Okay, then let me stop here. The only way by which you can detect breast cancer is X-ray or breast ultrasound. or biopsies. Okay, X-ray, breast ultrasound, and biopsies. So we've been able to look at types of teams, stages of teams, stages in a team. We've been able to look at a case study that has to do with breast cancer. Then we've seen the common signs and symptoms of breast cancer. Again, we've seen the types of breast cancer. Before I now begin to give room for questions, we'll also talk about causes of breast cancer. You see, I am giving an apology because I have to just be rushing because we have taken much time in this lecture before we start. You see, we've talked about causes of breast cancer. Then we've talked about the detection. How do we detect it? It is through X-ray or breast ultrasound or biopsies, BIOPSIES. You see, how do we prevent breast cancer? Through self-examination. It's a way to check your breast for changes on a regular basis. You have to check your breast for changes on a regular basis. Then let me quickly look at, before we go for question. Okay, let us stop here. Let us stop here for today. Let us stop here for today. Let us stop here for today. So we've been able to look at teams and the types of teams. Been able to look at stages in a team, like I said. We've been able to look at how to detect and treat breast cancer. We've been able to also look at the signs and symptoms of breast cancer. We've also looked into the types of breast cancer. And I think we've also looked into the causes of breast cancer. You see, so we are stopping here today because of the time. So I want to give room for question now.
Hello, sir. Good afternoon, sir. Hello, sir. Good afternoon, sir. Hello, sir. Good afternoon, sir. Hello, sir. Hello, sir.
Hello, sir. Good afternoon, sir.
Good afternoon.
This is
Can you hear me?
Yes, sir. I can hear you.
Okay, go straight to your question, please.
My question goes to, please throw a little light on signs and symptoms of breast cancer. A little light on
Breast
that.
and symptoms.
Also,
Breast and
yes,
symptoms.
Yes, and also the causes of breast cancer. We cannot get it. I cannot get everything that you mentioned.
Okay, let's quickly go into the signs and symptoms. Okay?
Okay. Yes, sir.
Somebody that is having cancer of the breast, they'll be having masses on the breast, like lumps. Are you getting it? It will not be painful at all. Non-painful one. Then they can also be swelling under their arms.
Okay.
Swelling under their arms. Then there will be changes in the nipple skin or discharge. Okay. Then you will begin, such person will begin to notice, flattening or indentation of the breast. It's either the breast will be flattened, or there will be indentation. Then there will be changes in the nipple. There will be changes in the nipple, and of course, there will be unusual discharge from the nipple. Unusual discharge from the nipple. Are you following?
Yes, sir.
Are you following? Now,
Yes,
the
yes.
last signs and symptoms here is that you will now begin to feel some changes in the breast, in the size and shape of the breast. You will be feeling some changes. So because of our time, let me quickly, you want to also know
The
causes of
causes
breast
of
cancer.
breast cancer. Yes.
Okay. Number one, we have biological factors. Biological factors or internal factors. Is there will be two like that? You either call it biological or internal factors. This has to do with your age and your gender. Okay?
Yes.
Number two, the environment in which we live is a factor on its own. That is an environmental factor. Okay? Then
Yes, sir.
how you are exposed, your exposure this time around is a factor concerning breast cancer. Your exposure to the outside environment. And we have occupational factors. The
What's
type of
number
work,
3? What?
Exposure.
Give me that. Number
occupational
3.
exposure.
Exposed. Okay.
Exposure.
Okay.
Can you hear me?
Yes, yes, I can
EX.
get it.
Exposure, environmental factor, occupational risk factor, the type of work you do. You understand? That is
Yes, sir.
occupational risk factor. Then your lifestyle related factors. The way you live your life matters a lot. Then
Okay.
medical treatment with drugs, medical treatment with chemotherapy, the use of drugs generally. Okay?
Yes, sir.
Then we have inherited genes.
Demerited.
Yes, you can inherit the gene of your father or your mother.
Okay.
Okay? Do you get what I'm talking about?
Yes, sir. Yes, sir.
So these are the major causes of breast cancer. And I've
Okay, sir.
said it before. How do you detect such people? You detect them through X-ray. You go
Yes.
through X-ray and you do breast ultrasound, and there's something we call biopsies. I want you to make a research on that. BIOPSIES. Go and research on it so that by next week you give me what you want. BIOPSIES. So that will be the assignment. Go and check what biopsies mean. Okay? Why detecting breast cancer? So we have 3 ways by which we can detect breast cancer: X-ray, breast ultrasound, and biopsies. Okay? I will never
Please, sir,
ask you
help
in
me with
exam
the
to tell me the meaning
definition
of
of
biopsy.
healthcare system, sir. Sir, please,
Healthcare
the
system.
team in healthcare system. Someone light.
Team.
Yes, in healthcare system.
Do you start this lecture with us?
Yes. You were fast, sir. We cannot get
Okay,
it.
okay, don't worry. The types of teams that we have.
The team, sir. No, sir, start from the team.
Please time up. Please time up.
Okay, sir.
Okay. So by next week, don't worry, we'll go through it again.
Okay, sir.
All right.
Thank you so much.
I don't even know. I just, hey, Jesus, I just let me check.